Good evening. Welcome back to Mike's podcast on rare diseases. Today I'll be discussing Conn syndrome. For those of you who have never heard of Conn syndrome, I'll give you a brief summary before breaking it down. Conn syndrome occurs in every 1 out of 100 cases of hypertension. It's different from other cases of hypertension because it is caused by overproduction of aldosterone, a hormone that controls sodium and potassium in the blood. Today I'll be discussing the causes, diagnosis, symptoms, and treatments of patients with Conn syndrome. Starting with causes, Conn syndrome originates in the adrenal glands, which reside on top of our kidneys. In some cases, one will develop a benign tumor on their adrenal gland. This will cause their adrenal gland to become hyperactive and produce more aldosterone than the body needs. The excess aldosterone in the body is what causes hypertension. When in excess, aldosterone causes imbalances of potassium and sodium in our blood, leading to too much sodium and not enough potassium, causing the patients to hold too much water, thus increasing blood volume and pressure. Conn syndrome in itself is not hereditary, but bilateral adrenal hyperplasia, a condition that could cause Conn syndrome, is hereditary. This leads to genetic testing being done in those who develop hyperaldosteronism before the age of 20 to identify if they are at risk. This is why it's important to make sure your blood pressure is good, and if it's bad, what the causes are. Moving on to diagnosing Conn syndrome. The most common form of testing includes getting a specialized blood test. Specialists look directly at your aldosterone and renin levels in your blood. Both are important hormones that help maintain homeostasis. In those who have Conn syndrome, there will be an increased level of aldosterone and lower levels of renin. In the blood test, if the blood test comes back with these readings, it's not uncommon for the doctor to run another test to confirm the diagnosis. This time, another blood test will be given, but with different factors, to manipulate the aldosterone in the patient's body. These different factors include giving medicine to the patient or introducing extra salt into their diet or via intravenous fluid. The levels of aldosterone remain high after these factors are introduced. It is confirmed that Conn syndrome is present. Next, I'd like to describe what life is like for those with Conn syndrome. The most common symptom is high blood pressure and abnormal electrolyte levels. With both of these issues working against the body, other symptoms may arise, such as a lack of muscle strength, frequent voiding, nighttime voiding, headaches, increased thirst, pins and needles, eyesight problems, paralysis, and muscle twitching and cramps. Lastly, I'm going to describe the treatment plan for a patient with Conn syndrome. In almost every case, hypertension medicine does not help with Conn syndrome. Other treatments that can be performed are a laparoscopy of the aldosterone producing tumors on the adrenal glands, if that is the cause. In addition to maintaining a low salt diet, not smoking, limiting alcohol intake, and exercising regularly can also help limit Conn syndrome symptoms. Thank you all for listening to my podcast on rare diseases. Tune in next time, the same. Tune in next time, next week.